Use of the single-dose Johnson & Johnson COVID vaccine won't hamper efforts to vaccinate U.S. citizens and those in this country. This as the CDC and the FDA are investigating safety concerns linked to that vaccine. The California Department of Public Health has directed healthcare providers to pause the use of the Johnson & Johnson vaccine until it receives further direction from safety experts. KTVU's Jesse Gary gives us the reason and reaction.
Tuesday, two federal agencies ordered a halt to the use of Johnson & Johnson's one-shot COVID vaccine at federal vaccination sites. The move comes after a half-dozen people developed a rare blood clotting issue 2 weeks after receiving the J&J vaccine.
Out of an abundance of caution, it's good that the FDA and the CDC is, putting a pause on, further vaccinations to make sure that indeed if it's the J&J vaccine causing these problems, to make sure that it doesn't balloon into a bigger situation that goes out of control.
All of the patients are women between the ages of 18 and 48. One woman has died, and a second is in critical condition in a Nebraska hospital.
We think there might be an immune response occurring to something in the Johnson & Johnson vaccine.
Federal officials say nearly 7 million people in the U.S. have received the J&J single shot. The CDC says another 9 million doses have been shipped to individual states.
It was clear to us that we needed to alert the public. We included the pause in addition to the alert so that there was time for the healthcare community to learn what they needed to learn about how to diagnose, treat, and report.
Biden administration officials holding a briefing mid-morning saying the Johnson & Johnson announcement won't significantly impact the nation's vaccination effort.
We want to get this worked out as quickly as we possibly can, and that's why you see the word pause. In other words, we want to hold off for a bit, and very well may go back to that, maybe with some conditions or maybe not.
There are no federal COVID vaccination sites in the Bay Area, but multiple private and municipal vaccination providers are saying they'll stop using Johnson & Johnson's vaccine. Napa County officials are switching to Moderna for use Tuesday. Officials with CVS say they're emailing patients to let them know their appointments have been canceled. Scientists at the CDC and the FDA will jointly investigate possible links between the Johnson & Johnson vaccine and the blood clotting disorder.